Abdominoplasty is one of the most frequently performed cosmetic procedures in the country today. Much of the increase in popularity is because of the popularity of the so-called mommy makeover procedure, where we combine several different operations in order to restore the body to where it was prior to pregnancy. And also we're seeing a lot more patients who've undergone massive weight loss, either through diet and exercise or through bariatric surgery. Consequently, the abdominoplasty is becoming ever more popular. I think this is a simple way to demonstrate the differences between a full abdominoplasty, a mini abdominoplasty, and liposuction, three of the major components of abdominal recontouring. Now, when we see a patient who's had enough, has had weight loss, but still has good skin, and we expect the skin would retract well, liposuction may be the answer, and it's certainly the simplest of the three. With liposuction, we make small puncture wounds on different parts of the abdominal wall and use what's called a cannula. The cannula is a hollow tube with a blunt end, and we insert that and bluntly break up the fat and suck it out. We do this in patients we expect the skin to retract and have a nice contour. Now, if we see patients who have some laxity of their skin, and if the laxity of the skin is confined just to the bottom part of the abdomen and the top part seems to be okay, we can do what's called a mini abdominoplasty. In a mini abdominoplasty, we do liposuction the entire abdominal wall to get it as thin as we can, and then make an incision down here to remove extra skin between the belly button and the pubic bone down here. Now, when we do that, if you can imagine the incision I'm making here is just in the paper, but the paper represents the layer of skin and fat, and the layer below that will be the muscle layer. So after we make that incision, we lift up that skin and fat layer up to the belly button. In a mini abdominoplasty, we don't go past the belly button. We stop there. We then pull this skin down and throw away the extra. So in a mini abdominoplasty, we've thinned out the abdominal wall with liposuction and taken out the extra down here. Nothing has happened up here because if we've selected the patient properly, they don't need much in the way of skin tightening up here. And also with the mini abdominoplasty, we normally do not tighten up the muscle layer because if we tighten up this without tightening that, we'll create a bulge up here. Now for patients who have more laxity up here, in combination with the laxity down here, we'll do a full abdominoplasty. Now in a full abdominoplasty, we make the incision, as I mentioned earlier, down here, and lift up that skin and fat layer up to the belly button, Now we want to get past the belly button to pull the skin down, but we don't want to lose the position of the belly button. So what we do is we cut around it and leave it attached to the underlying muscle layer. So as the skin and fat layer now is released there, we can elevate it all the way up to the rib cage. The next thing we do is we evaluate the muscle layer. Now many times after massive weight loss or pregnancy, we'll find these two muscles that are normally together somewhat separated in the midline. And if we find this separation here, we'll take stitches throughout that separation all the way down to the pubic bone, tightening up that muscle layer before we tighten up the skin and the fat layer. After we've established that tightness, we will then pull this whole skin and fat layer down and hopefully get that hole that we created past the incision so that when we throw everything away, the hole goes away. Occasionally, we are not able to get all the way down there, and the hole will end up somewhere between the belly button and the pubic bone. In that case, we still get to throw away the extra skin, we bring the belly button out through a new hole so it stays in its location, but we have to sew this up. In this case, the patient will end up with a low incision down here, an incision up and down here to close that hole, and again their belly button coming out through a new hole. When we're done with a full abdominoplasty, this layer here is a raw surface, as is this. It's very important for these two to quickly heal and stick to one another to obliterate that space so that fluid can't collect there. So it's very important in the first 2 weeks after this operation to restrict activity so there's not a lot of this type of shearing motion, which will disturb or break some of the previously healed areas and delay the wound healing and cause longer drainage from this area. But normally, if we can get this stuck within 2 weeks, the drainage tubes that are commonly put in can come out and the patient is well on their way to being healed. One of the things that's kind of important too is when we mark the patients preoperatively. When we bring them in the morning of surgery, I always ask them to bring in the briefest clothing they're going to wear in this area down here. And very commonly that'll be the bottom of a two-piece bathing suit. And so with that on, we can help design this incision so this longer incision can be concealed in that type of bathing suit. The tummy tuck is the central component of the so-called mommy makeover, because the tummy tuck, as I mentioned, requires approximately 2 weeks at home before we start letting the patients get out and about, but the whole recovery time is about 6 or 8 weeks. So very commonly women will ask to have other operations done at the same time to help fully restore the body, such as breast enhancement, being a breast implant and or a breast lift, or possibly even maybe a reduction, combined with liposuction of the hips and thighs. The nice part about that is the recovery of those two procedures is quite a bit less than the tummy tuck, and so a patient can have one operation, one anesthesia, one recovery time, and the whole package is less expensive than doing them all separately. In addition to the mommy makeover, we combine these procedures in many patients who are massive weight loss patients. A massive weight loss patient is defined as somebody who's lost more than 100 pounds, but those patients often have loose skin in the abdomen, loose skin in the chest, loose skin in the arms and legs, and very commonly we'll combine several operations at one time so that patients can have one anesthetic, one recovery time, and less expense.